So, as an educator and a director of an advanced practice registered nurse program, it's important for me to ensure my students have the most current and up to date information regarding how to properly care for diverse populations of people across the lifespan. Given restrictions on abortion care within Georgia, that certainly has limited students' ability to acquire access to certain types of education regarding abortion care. So it's important for advanced practice registered nurses students across the country to have access to clinical rotations that include sexual and reproductive health care, which includes abortion care. Having that exposure during your learning years as a clinical student allows for you to learn firsthand from a more seasoned practitioner within that space. Limitations in states across the nation have a grave impact on students' ability to access that hands-on clinical experience when it comes to abortion care. So when we think about abortion care and abortion access, we can't help but include the Black maternal health crisis. You already have marginalized communities of Black and Brown women dying at alarming rates from preventable healthcare conditions. Layered on top of that, you think about the inequities typically faced within Black and Brown communities, lack of access to quality health care, lack of access to quality food in the forms of food deserts within specific areas. These things have been put in place through things like structural racism or systemic racism. And then you layer on top restrictions to abortion care. Adding more restrictions on reproductive health care furthers marginalize this population of individuals and places them at greater risk for negative health outcomes, including death. But there are systems that truly have to be dismantled in order for these inequities and disparities to change within this community of individuals. So it's not a more critical time for me than now to be a women's health care nurse practitioner and to ensure that I'm doing my part to make sure that the people I care for and in the communities that they live in are receiving the most optimal health care.